a second. Thanks.
So, great. So it's 12 o'clock. I think I'm going to get started. I just want to welcome everybody. Hi. Thanks for joining us this afternoon. And I'm excited to share a few things, a few thoughts, and I hope actually this will be kind of a conversation for us as faculty, some of the common challenges we face, some of the things that we're building at PhysioU and what we're experimenting with the students and some of the outcomes. And ultimately, I would really be excited to get your thoughts on things that you need, things that, or conversations that would be useful to have that we could continue to have discussions about or that we could actually help to build. So my dream with PhysioU is to really create tools that improve learning for the students, that span from the beginning of PT school all the way into residency and fellowship education. I use it for mentoring in the spine fellowship and residency for USC when we train in China. And I use it throughout our curriculum. All of our faculty are using it throughout our curriculum. So we're learning to use it. It's not an easy thing, but I think the research suggests that students really appreciate when faculty try. And I realize also that though we think these millennials are very well versed in all of this technology, I think just like us, there is this wide spectrum of people who some are very well versed and some are not. They need you to talk them through it. And so I've spent a lot of time thinking about how to slowly engage the students and give them freedom to explore. And that's one of the key things that this chat is about, is how do we help students explore beyond the silos of the curriculum that we force them to stay in. So let me get started here and just say that we are recording this webinar just for people who aren't able to attend. This will be available on our site. Now, I have been teaching at APU for about 15 years, so I've spent a lot of time making a lot of mistakes. And earnest, deliberate attempts to be a great professor didn't always turn out well. And I hope as we're able to share this openly that people will be able to connect with that feeling. And we always have this burden. We really want the best for these students, but we're kind of trapped by the sequencing of our curriculum and the overabundance of stuff we feel like we have to teach. So I think that those are all ripe for discussion, and I'll definitely want to make some time for that. I'm a teaching and learning fellow here at the university. I've had a lot of chance to think about and meet expert teachers and to try to re-examine, are we doing, is the traditional way the best way? Or are there ways that we can augment it or improve it? And I teach also for the Kaiser Orthopedic Residency and Sports Fellowship, as well as the Spine Fellowship for USC. And we have been developing apps the last 6 or 7 years, and I chair the Institutional Review Board here at the university. Just as a quick glance, there is a growing and emerging group of evidence that is looking at technology in PT education particularly. And I think it's very relevant because we are a very technique-based profession. And so as we've been preparing to submit for CSM and for ELC, we've been doing a big lit review. And these are things that I've been thinking about and as we produce some of this stuff that I'm going to share with you. One of the key comments that I thought was very interesting out of one of the case studies was the implementation of technology can enhance learning by making the classroom more active and student-centered. What I think that means to me is that these apps aren't meant to just be delivered. You guys go use it if you want. I feel like many of these apps can be used to drive interesting conversations, can be used to help with case studies as they're doing things in class, can be used to help students look at techniques before they come to class. So I think that apps actually are not that useful just by giving it to someone. And that's part of why I'm here to share a little bit of how we're doing this. And I also think it's interesting to show that this case study said meeting students at their level of comfort with technology can be the key to the whole puzzle. And I feel that's the same for faculty as well. I've spent the last 5 years trying to figure out how do I best help the students learn using these apps that sometimes have lots of content, lots of bridges that we're trying to build. How do we help them unlock all of that? And what I realized, actually, my students would come to tell me and say, man, I wish you had walked us through that earlier in the program, because then we would know that we could do it ourselves. We kind of need a little tour. And so I hope to share a little bit of that with you. Our team, all faculty members, all fellowship-trained clinicians, have been dreaming, and mostly all faculty members, have been dreaming of going after the low-hanging fruit first. So you can see that we build apps that work on your computer. All of you, after this session, have access to all of our apps. They also work on your mobile devices. So basically, the students never have to choose what to carry around. They can access this information anytime. And our students get these apps at the very beginning of PT program. So this is my gift to all of our students. From the very beginning, they have these apps, and we begin to reference it and allow them to explore it every step along the way of the curriculum. So 3 top objectives that I want to get through today is to share some common faculty challenges. So a lot of you have been emailing us, sharing some of the challenges, and I find great comfort in it, knowing that it's just not me struggling with all of these things. So I'm going to share some of the summary of that. And then building bridges with PhysioU. This is an evolving case study. It's stuff that we're trying that we think you might be useful to you, and we'll share some of these resources that we're creating. And then at the end, and any time along the way, please feel free to unmute yourself, jump in, ask a question. If you have ideas, if you have concerns, if you have ideas on how to study this better, these are all things, or things that you feel like need to be built. We are here to do that. So let me get started with some of these common issues from faculty, which I think are quite interesting. Students want to see every skill before they attempt to perform it. They look at pictures, but they don't read the textbooks. This is related to this class. This is from someone recently who sent this in. So they want to see things because I think it's easier to model things, right? And when we were looking at actually the assistive devices, transfers, gait training textbook, we thought, man, it would be so much easier than them having to look at 7 black and white pictures of what a modified 4-point gait looks like, than to just watch one video and then allow us to discuss it and have them try it. So I think there is a discussion to be had about what is the best medium to train our students to do the things that we hope they can do. Another common comment was too many resources, too much information. They can't get through it all. So I would be very interested to hear how many textbooks that you are requiring a student to get. So in orthopedics, we've trimmed that down a lot. This will be the last year that actually we'll always have certain textbooks, and I think that's useful to share. There are certain textbooks that I think provide a depth that it's important for our students to study. This is how we learned. This is how I think it's important for students to learn how to do that. And yet there are several textbooks that I don't use anymore because I felt like to learn how to do that particular thing, that particular exercise, would be much easier just for me to film it, to show it, and use the notes, and allow them to use the apps to figure out where it goes. Right? Many of these exercises they've seen before. It's just they don't know when or where to use it. That's why we built these apps. So in my dream also, we are lowering the cost for students and changing the way, meeting them where they desire to learn. As always, the amount of material to cover is ever expanding. Many of you who are in musculoskeletal or in orthopedics, you know what it's like to teach shoulder lab. I can't remember half the special tests that I thought I needed to teach. And so we've really tried to trim a lot of that out, to give them the best of what they need and to categorize it appropriately. And again, the apps can be very useful for that. Something that a black and white piece of paper, a lab manual or lab sheet can't do very well. Many of the apps that we've built, we try to create context and organization. I can show you that. And someone also mentioned assimilating large amounts of material and knowing how to apply it versus just memorizing it. So I think this is a request from a faculty to say, please give us tools that we can use to engage the students with movement analysis, with clinical reasoning, dosing, some of these questions that no one really has good answers for, but really we should be able to demonstrate our expertise and guide them along in their thinking process. I think these are very, very important concepts that will revolutionize how we train clinicians of tomorrow. And then keeping resources current. So the reason why we built these into web-based apps is because I can change it anytime. We recently just refilmed a bunch of things. A colleague, Eric Fomar, out of Northeastern, he said, hey, we do palpation, soft tissue palpation. Could you film that? Here's a list. We filmed it and added it to an app because we thought that really makes sense for that app to have bony and soft tissue palpation, and the bulk of the programs may benefit from it. And I think it's valuable. I think most of us have thought about this a lot, is how to meet the multiple learning styles of the students. So I just want to take a second here, open it up to anyone who's joined us. If you want to unmute yourself and just share a comment or two about any of the other challenges that you face or that you face as you're teaching. So I'm just going to open it up for a second here. And please feel free, if you have comments, you can type it into the chat as well, and someone will read those out and kind of engage me related to those comments. Anybody? Yes?
Yeah, hi. This is James. Thank you, Michael, for doing this. I think my biggest problem with textbooks, and I usually, for the basic things like manual muscle test and goniometry, I refer to a couple of them. I don't require the students to spend $1,000 or whatever it is
right
on each. But very often there are nuances and differences between techniques.
Yes.
Some of them aren't even that subtle. They're pretty different. So
yeah.
How do you address that? I worry about that.
Yeah, great. It's a great question. So when we were doing the range of motion manual muscle test app, we had used, of course, we started with our own textbook, which was Berryman and Reese as the standard. And as we film things, many colleagues from the East Coast said, hey, we're using a different textbook. Grade 0 through 2 is a totally different position than what you filmed. So what we did was we went and filmed some alternatives so that a faculty member could say, hey, this is how I teach it. This is how I want you to do it. You can see that there's variations, and we're just going to have to, I think we're going to have to live with that. And you'll be surprised. There's so many textbooks for range of motion MMT with minor variations. It's hard to even say who's right. It's almost the case where whatever you're going to show them, let's try to make it consistent throughout the entire program. I think that's the most important thing. So in fact, we're having that conversation as we speak in our program related to manual muscle test, because our manual muscle test instructor has a few things that he's really particular about. And though we followed a few key textbooks to try to make it as standard as possible, he says, I'm still using the app, but there are certain things that I'm going to add in that is my preference as a clinician. And I think that is why students come to school. That's why they came to learn from you. So I think inevitably we have tried, and based on feedback from people like yourself, we will continue to film and update things and give some options. But sometimes I think too many options is just bad news in general. So it would be very useful, I think, as it's a little bit of wishful thinking, but as a profession and as a group of faculty, to try to standardize things a little bit. And we have enough of those problems among ourselves within a small cell of faculty. But the benefit of us building the apps for the major content areas is that we can all agree now that when we kind of do dermatome testing or myotome testing, that we're all following Asia. And that's built into the apps from the very beginning, and they can kind of look at it ahead of time, and us faculty can kind of go to it. And so that it's kind of helped us, in a sense, to try to standardize a little bit. But I don't know if that answers your question.
No, it actually does a lot, and it's very helpful. And I'm embarrassed to say, because you gave me access to the app a while ago, and I haven't been able to use it or look at it. One of my colleagues does. But I will tell you that what would be really helpful is if you were to, let's say, do manual muscle testing based on one text, and the text you use is the one I used. And then let's say there are alternatives. If you would say, here's an alternative, and it's Norkin and White or something like that, and particularly with the date, this is the original text, Reese Berryman, 2016, 6th edition. So then I would feel confident saying to students, this is what I'm comfortable with. Here's a Norkin and White. That's 2015. That's the alternative a lot of people use. So then students know that this is the most recent.
Right.
This is an alternative, which, is maybe not as recent, but who cares? If another faculty member really likes it and it's a good technique,
right,
who am I to judge? But at least they know sort of how current it is, as well as who it comes from.
Yeah, I think that's a great that's a great comment. I think we'll have to look at it through the app and definitely try to honor the work. I mean, these authors put in a lot of work,
yes,
to create these amazing resources for us at that phase, and I think technology is allowing us to evolve. And I think you're right. If we can cite better, like most of our other apps, everything's cited to PubMed abstracts. So I think we can go through and do a revision and try to give the faculty member a sense of where this is coming from. That will help. So I think that's a great comment, and we'll go through and definitely do that.
I know it's a lot of work, but then I really appreciate it.
Absolutely. Absolutely. Yes.
KB Castle, she does not, or he, I'm sorry if I'm wrong, but does not have the microphone, so I'm just going to read the question. It's a great question. In adult neuro and pediatric classes, having students learn how to decide what to do next when there is not a specific exam format, but rather rules for implementing an exam, depending on how the patient presents and what the patient demonstrates.
Yes, I love it. So my students right now are in neuro. They just came out of this very clearly patterned out, guideline-based ortho series, and they said, we are at a loss because no spinal cord injury fits any particular one pattern, or a stroke patient. It's not like, hey, my knee's stiff, can you unstiffen my knee? So what we are doing with that, as you can see, we have been filming neurotype patients, and we already have some filmed, and we're going to continue to film over the summer. We are going to film them all doing common functional movements, like sit to stand, stand to sit, reaching, scooting, to give the faculty member a tool to be able to pull up on the screen, and they can actually pull up a video of someone who does it normally, so someone who's fully healthy, and someone who has a stroke, and allow for those conversations then to drive the connection to, don't you think that this movement should look like that movement? So perhaps we can, in class, what we're going to try is we're going to try to facilitate this particular movement or this weight bearing through this limb. So I would say that the same thing with peds. We've just finished filming all the babies for every month of development, and we are actually currently following a couple of babies, one that's not normally developing.
What?
Yeah, one that's not normally developing and one that is fully normally developing, and we're following them through every month of their first year. And that will, again, be another resource where faculty can just pull up, hey, this is month 3. Let's take a look at the patient in or the baby in supine. What do you see? These are some of the things that I'm looking for. And hopefully when we are able to finish filming the baby that has some abnormal development, we can allow that to be a contrast and to drive the connection to the interventions. So I think that really ties into this idea that the students need to be able to see the patient, to see the movement, and to be able to allow the instructor to now leverage their expertise and and build the bridge forward than just say, please imagine a patient that looks like this. So I think that's a very, very relevant comment, and that we're done filming the peds, really. We're just following this baby for a whole year. So we're at 6 months for the 2 that we're following for the whole year. It's a big project. It'll take a little time, but your comments, your support, and your even as you write to me some ideas of things that you want to see, please feel free to write those, because we just keep building, and it is the voice of the faculty that really helps us to fine-tune the product. I mean, you can imagine how large. It took me 5 years just to finish orthopedics and to cover all the body regions. So